40-year-old woman came into my clinic last week looking fit and healthy. Her HbA1c came back at 44 millimoles per mole. That's fine, she said. My doctor told me I'm not diabetic. She was technically correct, but what nobody had explained to her was that at that exact moment, glucose was attaching itself to proteins throughout her brain, stiffening blood vessels in her heart and damaging her kidneys. Not because she had a disease, but because that's what glucose does when it's slightly elevated every single day for years. I'm Dr. Max. I'm a physical therapist, but my passion extends far beyond rehabilitations. I spend years immersed in medical research because I'm obsessed with understanding what actually keeps people healthy versus what breaks them down. Most of the people leave their doctor's office with an HbA1c results and absolutely no understanding of what they've just been told. They think it's a diabetes test. You're either diabetic or you're not. But HbA1c is not measuring whether you have diabetes right now. It's measuring how much biochemical damage has been quietly accumulating in your blood for the last 3 months. And by the end of this video, you'll completely understand why this number matters more than almost any other health markers. So, what is HbA1c actually measuring? Here's what everyone gets wrong. They think it's a diabetes test. Binary thinking. You're either diabetic or you're not. If you are not, you're fine. That binary thinking creates one of the most dangerous blind spots in modern medicine. Inside your red blood cells, there is a protein called hemoglobin that carries oxygen throughout your body. When glucose circulates throughout your bloodstream, some of them spontaneously binds to that hemoglobin. The higher your average blood glucose, the more sugar molecules attach themselves, and that attachment is permanent for entire lifespan of that red blood cell, roughly 8 to 12 weeks. So when you see your HbA1c results, what you're looking at this weighted average of your blood glucose exposure across to 2 to 3 months. Not the spike you had after breakfast yesterday, not what your glucose is doing right now. The total biochemical exposure your tissues have been sucking in. Day after day, meal after meal, for months. And here's what that distinction matters enormously. Let me ask you a question. Why is glucose attachment so damaging? The answer is glucose binds to hemoglobin. Big deal, right? It's just sticking to the surface like a label on a bottle. Except that's not what's happening at all. This binding process, what we called glycation, fundamentally changes the structure and function of the protein it attached to. And here's what nobody tells you. This isn't only happening in extreme diabetic states. It's a basic chemical reaction occurring in everyone's body all the time. The only variable is how fast. What makes this insidious is that glycation doesn't stop at hemoglobin. Glucose is binding to proteins all over your body, in your blood vessels, in your skin, in your kidneys, in your eyes, and in your nerves. Once a protein becomes glycated, it loses its flexibility. Blood vessels that should expand and contract smoothly become stiff and brittle. Enzymes that should perform precise biochemical tasks start malfunctioning. The damage compounds over time because glycated proteins trigger oxidative stress, creating reactive molecules that damage your DNA, your cell membranes, and your mitochondria. And this is happening right now in proportion to your average glucose exposure. Medical guidelines defined an HbA1c below 42 is normal, but between 42 and 47 as prediabetic and 48 or above as diabetic. But those cutoffs hide an enormous amount of variation in biological risk. Someone with an HbA1c of 35 and someone with an HbA1c of 41 are both stamped as normal, yet their long-term health trajectories can be dramatically different. Their research on cardiovascular disease tells a stark story. Every single point increase in HbA1c, even within the so-called normal range, which corresponds to measurable increasing in heart attack and stroke risk. That relationship doesn't suddenly switch on when you cross the diabetic threshold. It's a small continuous gradient that starts well below the diagnostic cutoff. Normal is not the same as optimal. Optimal HbA1c for longevity and performance appears to sit somewhere in the low 30s. Where glycation is minimal, insulin sensitivity is high, and metabolic flexibility is preserved. But here's what people don't realize about their day-to-day symptoms. Fatigue that gets blamed on stress or lack of sleep is often rooted in poor glucose regulation. Mood instability, difficulty concentrating, constant hunger, afternoon energy crash, all of these are downstream consequences of the same metabolic dysregulation that drives HbA1c upward. When someone tells me they feel fine with an HbA1c of 44, what they're often describing is a recalibrating baseline. They've adapted to feeling suboptimal for so long that they've forgotten what it genuinely feels like to have good energy. This is one of the most powerful health literacy blind spots in modern medicine. People get told they're fine when their HbA1c is 40, but they're already on a trajectory toward disease, already experiencing subclinical symptoms, already accumulating vascular and neural damage that will only become clinically obvious years later. So, why does HbA1c drift upward so easily in modern life? What's driving HbA1c upward in millions of people? The answer is HbA1c doesn't drift upward because of genetic bad luck. It drifts upward because modern environments are biochemically hostile to stable glucose regulation. The default food landscape is engineered to spike blood sugar rapidly and often. The default work culture eliminates movement. The default sleep on stress patterns disrupts the hormones that keeps glucose in check. Ultra-processed carbohydrates break down into glucose so quickly that your pancreas has to release massive amounts of insulin just to keep your blood sugar from spiking dangerously high. When that happens multiple times every day, your cells gradually become resistant to insulin signaling. That insulin resistance is what drives HbA1c upward over time, even if you're not eating what you would consider junk food. But ultra-processed food is only part of the problem. Sleep disruption amplifies everything. When you don't get enough sleep, your body releases more cortisol and adrenaline, both of which raise blood glucose. At the same time, sleep deprivation increases hunger hormones, making you crave exactly the high sugar, high carb foods that spike glucose further. One night of poor sleep alone can reduce insulin sensitivity by up to 30%. Imagine what chronic stress restriction does over months and years. Stress hormones work through the same mechanism. Cortisol and adrenaline mobilize glucose into the bloodstream to fuel a fight or flight response. Useful when stress means physical, dangerous. But in modern life, stress is psychological and chronic, which means your body constantly flooding your blood with glucose that never gets burned off. Loss of muscle mass makes everything worse because muscle is your body's largest glucose disposal site. When muscle mass declines, more glucose stays in your bloodstream for longer after every meal. Let that sink in for a moment. The combination of processed foods, sleep deprivation, chronic stress, and muscle loss creates the perfect storm for rising HbA1c. And when HbA1c rises, the damage doesn't stay confined to glucose metabolism. Let me ask you a question. What's actually being damaged as HbA1c rises? The answer is, when people think about blood sugar, they usually think about weight gain or diabetes. But HbA1c isn't just a metabolic marker. It's a multi-organ aging accelerator that affects every system in your body simultaneously. simultaneously. Your brain is particularly vulnerable because neurons are highly dependent on a stable glucose delivery and insulin signaling. Elevated HbA1c means your brain has been exposed to erratic glucose swings and chronic insulin resistance, both of which impair the brain's ability to use glucose efficiently. That's one reason why people with higher HbA1c, even below diabetic levels, show faster rates of cognitive decline and higher dementia risks. Your cardiovascular system takes the similar hit. Glycation stiffens the walls of your arteries, reducing the ability to expand and contract. That stiffness increases blood pressure, forces your heart to work harder, and damages the declining lining of blood glucos, and damages the declining lining of your blood vessels, where atherosclerotic plaques begin to form. The microvascular damage is just as important. Tiny blood vessels in your eyes, kidneys, and nerves are extremely sensitive to glycation. When those blood vessels become stiff and leaky, oxygen delivery to tissues becomes impaired. That's why diabetic retinopathy, kidney diseases, and peripheral neuropathies are so common with prolonged high HbA1c. But the process starts long before clinical disease appears. If you could pick only one blood marker to predict your long-term risk of chronic diseases, HbA1c would be near the top of the list. People with HbA1c in the prediabetic range have roughly double the cardiovascular risk compared to those with optimal HbA1c, even after controlling for other risk factors like cholesterol and blood pressure. Dementia risk tracks with HbA1c in a way that surprises most people because they don't connect blood sugar with the brain health. But multiple large studies have shown that people with higher HbA1c levels in midlife have significantly higher rates of Alzheimer's diseases and also vascular dementia decades later. Kidney disease becomes almost inevitable with prolonged high HbA1c because the kidneys' filtration membranes are extremely sensitive to glycation. HbA1c is one of the clearest earlier risk indicators in all preventative medicine. It reflects to many downstream processes at once. Let me ask you another question, which raises the obvious question. Can it be changed? Here's what actually drives HbA1c down. What has the most leverage on glucose regulation? The most effective way to lower HbA1c is not through willpower or deprivation. It's through understanding which biological inputs have the most leverage. Muscle mass is arguably the single most powerful long-term lever because muscle is your body's primarily glucose disposal site. When you eat carbohydrates, the glucose can either go into your bloodstream, into your liver as glycogen, or into your muscles as energy. More muscle means more storage capacity, which means less glucose stays circulating in your blood. Resistance training 2 to 3 times per week is enough to gradually build and maintain muscle mass. That muscle continues improving your glucose metabolism 20 hours a day, even when you're not exercising. But there is a timeline you need to understand. Why does HbA1c take so long to change? The answer is one of the most common mistakes people make is expecting HbA1c to drop rapidly after a new days or weeks of healthier eating. But the biology doesn't work that way. HbA1c measures glycated hemoglobin inside your red blood cells, and those red blood cells have lifespan of roughly 8 to 12 weeks. That means the HbA1c value you see today is a weighted average of your glucose exposure over approximately the last 2 to 3 months. When you change your diet, exercise habits, or sleep patterns, you won't see that reflected in your HbA1c for at least several weeks. The time lag is why people often give up too early. They make significant lifestyle change, test their HbA1c after 2 weeks, see minimal improvements, and conclude nothing is working. But the truth is that improvement is happening at the cellular level. New red blood cells are being produced with less glycation, but the average hasn't shifted yet. The typical pattern is that you'll start seeing directional movement within 4 to 6 weeks if changes are meaningful, and full recalibration takes around 3 months at least. What matters more than intensity is consistency. A single day of perfect eating doesn't move the needle because HbA1c is an averaging process. What moves it is sustained behavioral change over weeks and months. If you strip away all the clinical jargon and diagnostic thresholds, what HbA1c represents is a biological aging speedometer. It's telling you how fast your cells, tissues, and organs are accumulating damage relative to your chronological age. People spend enormous amounts of money on visible signs of aging, wrinkles, gray hair, skin texture, while completely ignoring the invisible aging happening inside their blood vessels, inside their brain, throughout their organs. HbA1c gives you a window into that invisible process. The remarkable thing is that it responds to behavior. It's not fixed by genetics or determined by age. If you improve your sleep, build muscle, reduce processed carbs, manage your stress, and move your body more, your HbA1c will improve. And when it improves, you're not just lowering a number on a blood test. You're slowing down the biological aging process itself. Energy improves because your cells are more insulin sensitive. Brain health improves because glucose stability supports cognitive function, and heart health improves as your blood vessels remain flexible. HbA1c doesn't judge you. It simply records a biochemical story your daily life is writing in your bloodstream. If that story involves ultra-processed foods, sedentary behaviors and lifestyles, and poor sleep, your HbA1c will reflect that. If your story involves whole foods, daily movements, consistent sleep, and stress management, your HbA1c will reflect that too. This is the essence of the 1% health rule. Tiny daily decisions compounding into long-term biological outcomes. You don't need to make dramatic changes overnight. You just need to shift the averages. Eat slightly better most of the time, move slightly more each day, and sleep slightly more consistently each week. Those small shifts maintained over months and years are what pull your HbA1c down from high-risk zones into the optimal zones. In the next video, I'll show you the 5 morning habits that add years to your life. I'm Dr. Max. Your HbA1c is not destiny. It's your feedback. And feedback is only useful if you act on it. Thanks for watching, and I'll see you in the next video.